This is Dr. Mayberry, and this is our lab discussion of the lower limb. I need you to think about the human lower limb in its evolutionary import. It is what allows us to be bipeds. We are the only living bipeds. Our lineage, or the only living striding bipeds, our lineage is the only striding biped lineage that has ever, to our knowledge, been in existence. So this is a distinctly hominin trait to be striding bipeds. They allow us upright posture, which is corresponding with bipedalism. So you can see in this sketch here that we have similar layout. We talked about that with the upper limb. We're still tetrapods and everything. But these are what we walk on. Here is a horse lower limb. We have similar muscles. That's also evolutionary, but they attach in slightly different places. They're slightly different shapes in order to facilitate that different movement than other mammals, other organisms in general have. Though the osteological bones do have identical or very, very similar bones throughout kingdom Animalia. So again, we are tetrapods. We talked about the upper limb already, but now we're focusing on the lower limb. There are some differences, though the layout, that 1 proximal, 2 intermediate, the rows of podials, and then the phalanges, that layout is the same, of course, but they move a little differently. So the forearm, the forelimb rather, which is the arm, the elbow functions posteriorly, so when you bend your arm, that elbow goes backward. But if you bend your leg, your knee bends anteriorly or toward the front. Your arm is highly mobile due to that glenoid fossa and humeral head. It's a very, very mobile joint, but the hip is not very mobile. So the hip, your legs they have a much more restrained movement than your arm does. So that's because we have to have very stable lower limbs for our mode of locomotion. If your leg could move in every direction, running would be significantly more difficult. And through much of human and hominin history, running was probably very important. You outrun predators, you run while you hunt, mobility and stable mobility is critically important to survival. So it's important that the lower limb be much more stable than the upper limb. Here's the layout of the lower limb. I didn't make this image. It's got a couple of typos on it, but it gives you the idea. So we start with the innominate or the os coxae. That's the ilium, ischium, and pubis. In adults, they're fused. They look like one bone, but it's really made of 3 bones. Then we have the femur, which is that proximal leg, which is the thigh. You have the patella, which is your kneecap. The tibia and fibula are your leg or your lower leg bones. And then you have your tarsals. There are 7 tarsals total. There were 8 carpals, so that confuses some people. You need to know there are 7. The calcaneus is the heel. The talus is in the middle of your ankle. The navicular, the cuboid, and 3 cuneiforms are in the body of your foot. Then you have the metatarsals, and then you have the phalanges. Here's the pelvic girdle up close. We save the sacrum when we talk about the vertebral column, so in the pelvic girdle, we're really just looking at the 2 innominate bones. So the ilium is the blade, the ischium is your ass, it's what you're sitting on, and the pubis is anteromedial. It's this front and center area. So this stabilizes the pelvic girdle, this pubic symphysis here. The ilium especially is really pivotal for muscle attachments, for mobility of your your lower limb. So your gluteus muscles, your gluteal muscles attach there. Those are your butt muscles. So other things do as well, but those are really important for you to realize. So we have actually a different shaped ilium than quadrupeds do. Even chimpanzees, they have this very long ilium that sort of goes up their back a little bit. We say that ours are broader, they're shorter, and this is for those gluteal muscles to attach slightly differently because we walk slightly differently. So This is just important to recognize that if you looked at this in a monkey or a chimp or really any other organism than someone in the hominin lineage, this ilium is going to be very differently shaped. So here is the hip, which is comprised of the acetabulum, which is really part of all three bones in the innominate, and then the femur. So the femoral head inserts into the acetabulum. That's that ball and socket joint that is the hip. And you can see here, this is human, this is gorilla. We have different, the layout is the same, but the muscle attachments and the way that we stand, the way that they articulate specifically is different. And a lot of that has to do with that ilium being a different shape. You can see how in the gorilla it's longer and thinner and it goes up the back, where ours is bowl shaped, it goes out to either side. So we have more extension of the hip, more abduction. So this is important for us to be able to walk bipedally. Our femur is our thigh. Our femur is slanted inward slightly, and you can tell that if you sit the femur on the table with both condyles resting on the table, you will see that it has a slight slant to it. That's the bicondylar angle, or the carrying angle of the femur, and it allows our center of gravity to be in the center, below us. So over here on a quadruped, there is no real slant to the femur. The leg would go straight down, which would not allow them to be bipedal. They couldn't walk the way that we do. So that compensating angle there is very important for our stride. The knee is this incredibly critical joint, and it's shockingly shallow. So there's a lot of soft tissue that stabilizes the knee, and that's very important. It's made up of several different bones, actually, well, three. The femur, the patella, and the tibia. The fibula isn't really part of the knee itself, so you don't need to worry about that in this respect. So we have different condyles on the femur and the tibia that are articulating, and it's ligaments that really stabilize it. And then that patella is a sesamoid bone. It's actually in a tendon. The tendon comes from your quadriceps femoris muscle up here, and it inserts into the tibial tuberosity. So it's this floating bone, which is what a sesamoid bone is. So it fits between the two femoral condyles, and it also aids in stabilization of the knee. The leg is your tibia and your fibula. So here you can see how the fibula articulates here. It is not part of the knee itself. And there is fibrous joint, or the whole fibula attaching to the tibia is a fibrous joint. So fiber binds the two bones together. This is the interosseous membrane of the leg. You have an interosseous membrane in your forearm as well, between the radius and the ulna. In the leg, it stabilizes the fibula. The fibula doesn't bear any weight. It's this skinny little bone here. The tibia is effectively bearing all of the weight of your whole body, really. So it's a very strong bone. So this membrane, this interosseous membrane here, but there's also an articulation point up here and another one down here where the tibia and the fibula articulate. And then we have our 7 tarsals in the foot, the metatarsals, and then the phalanges, proximal, intermediate, and distal. And of course the big toe, like the thumb, only has a proximal and a distal phalanx. Here is the layout of the foot. You do need to know this. I won't test you on which of the cuneiforms is intermediate, lateral, medial, but you need to know that these 3 bones right here, these 3 bones right here, watch my mouse when I'm talking, are the cuneiforms. So you have your calcaneus, which is the heel, talus, navicular, cuboid, and then the 3 cuneiforms. So you do need to be able to recognize those. You also need to know that part of being bipedal is really reliant on the foot, which hopefully you already realize, but the structure of the foot in terms of both skeletal anatomy and soft tissue is pivotal. So we have our arches in our feet, and if you have flat feet, you lament the lack of your arches, because arches are really important for structure in the foot. It's painful if your arches are collapsed. It can lead to additional stress on the foot and fractures in the bones. when your arches are collapsed. So these 3 arches here are very important, and you don't need to know the names of them, but you need to realize that arches are important in the feet because it helps the feet expand and contract as we move. If you jump, your arches are sort of shock absorbing, so they're very, very important. And they're all strung together. It's the soft tissue that creates the arches in our feet, which is how they can sort of collapse if the soft tissue stretches too much, if there's too much weight on them for too long. The big toe is big because it, when you stride, supports all of the weight of the body for a minute, for a second, a split second really. So our big toe is aligned with the rest of our toes. That's important for the push-off on our stride. So get up and walk around the room for a second, and you realize that you are pushing all of your body off the ground with that big toe for just a second. And the calcaneus, the heel, is huge as well because that absorbs the weight of your stride as you touch your foot to the ground, heel first, as you walk. So it is large and very sturdy as well. So this stride, as you're walking around the room, is really facilitated by both the way all of our bones articulate and the soft tissue involved in holding us together, basically. So anatomy in the lower limb is so important. It's a really pivotal aspect of being human and being a biped, so you really need to understand this. So that sums up our lower limb discussion. Make sure that you're studying all of the landmarks and all of that for class as well.